The infratemporal fossa contains the divisions of the branches of the trigeminal and maxillary artery. So the important divisions of the trigeminal nerve to learn are the mandibular roots. It all starts here in the semilunar or trigeminal ganglion, with the maxillary branch going this way. So here's the maxillary branch. The first branch going through the superior orbital fissure, the maxillary branch through the foramen rotundum, and the mandibular branch through the foramen ovale. And then this is divided into the inferior alveolar nerve, the lingual nerve to the tongue, the nerve to mylohyoid branches off the inferior alveolar. The mylohyoid is a triangular muscle of the neck which elevates the hyoid bone and the tongue, so is involved in swallowing and speaking. So it's not innervated by the hypoglossal nerve, but the mylohyoid nerve from the third branch of the trigeminal. The buccal nerve is sensory to the cheek, not to be confused with the buccal branch of the facial nerve, which motor innervates the buccinator muscle. All of this is going on beneath the infratemporal fossa, which is the area just below the zygomatic arch, which goes across here. It's still happening underneath that. The maxillary artery branches from the internal carotid, going across the face, arising behind the neck of the mandible, and so crossing the top of the Temporomandibular Joint. It's actually the larger of the two terminal branches of the external carotid, the other one being the superficial temporal. When the blood vessel first arises, it's actually embedded in the parotid gland itself before crossing the inferior alveolar nerve, running along the inferior border of the lateral pterygoid muscle, then runs forward and obliquely and slightly upward underneath the ramus of the mandible coming across, and the insertion of the Temporomandibular Joint, and usually deep to the lateral pterygoid muscle, before the third and final part enters the fossa. Well, that is the pterygopalatine fossa. The Temporomandibular Joint is the only joint that's movable in the adult skull, and it's an articulation between the mandible and the zygomatic process of the temporal bone, connected by the temporomandibular ligament here and capsular ligament here. The TMJ is one of the only synovial joints that contains an articular disc, dividing the joint into two separate synovial capsules. The disc runs along the top of the joint, like this, with the lateral pterygoid muscle on one side and the ear canal on another. But basically, the disc allows both hinge and gliding movements, with hinge movements taking place in the lower compartment. So by two cavities, I mean there's one here and one here, either side of the disc, above and below it. So the hinging movement particularly takes place between the condyle of the mandible and the disc, and the backward and forward movement takes place mainly between the disc and the surface of the temporal bone.